So for sleep apnea, the oral appliance is typically used when a patient is, number one, CPAP intolerant. They might just not like the way the machine feels. They might have claustrophobia wearing it. They might feel like they have a Darth Vader mask on. There's been all kinds of descriptions of it, but the oral appliance works, and particularly the one that I use here in the office is called the Micro 2. It's made by ProSomnus. They're located here locally in Dublin. And this appliance works by kind of moving the lower jaw a very slight amount forward. That's what makes it different than the other appliances. Most appliances are titrated or brought forward about 4 millimeters, which is quite a bit. And the average titration for the Micro 2 is about 0.4 millimeters, which is a huge difference. The reason why that's important is if you're bringing the jaw forward, you're a lot more apt to start to feel some TMJ symptoms, possibly some joint symptoms. If you're barely titrating the jaw forward, you're less likely to have those kind of symptoms. It's made very specifically for each patient. So we're talking earlier about physiologic-based dentistry. This would be a perfect example. So we are tensing the patient. Tensing is a physical therapy term. It's basically a electrical stimulus to 3 cranial nerves. Those nerves are connected to many muscles in the face. And what we're trying to do is trying to relax the muscles as much as we can. So TENS is the only thing that is okay in terms of the FDA for relaxing muscles. It's the only thing been approved to relax muscles. The physical therapist might use other things called H-wave that you've heard of if you've had a knee injury or a shoulder injury. That strengthens the muscles, it doesn't relax the muscles. So we're tensing the patient to relax the patient, relax the muscles around the joint and what supports the jaw. And then we're taking a very specific bite on that patient that is only, again, unique to them because we're using instruments that measure muscles. So we're measuring the temporalis muscle, we're measuring the masseter muscles. We want to see the temporalis muscle as low as we can get it in the term microvolts. So it's just a very gentle surface pad that goes on the skin and allows us to measure that muscle's activity. So again, it's very, very unique to that individual. The bite that we're getting is what the laboratory uses to manufacture the appliance. And it's an upper and lower plastic appliance that's very sleek and form-fitting. There's nothing on the inside part of the lower jaw, so it's what we call lingualist. So there's a lot of room for your tongue. And the tongue is one of the biggest things that causes obstruction. So the more room you have for your tongue, the better. That's how they're made.